since we don't have any vaccine for children, so they're all vulnerable, and that's the reason why we feel that the third wave is going to impact the children more.
Hello and welcome to Nation Talks. I'm Preeti Prakash. As the second COVID wave is showing a downward trajectory, at the same time, there are apprehensions of the third wave soon following. To rule out the bad experiences of the second wave, government is bracing up for the third one, which is said to be affecting our children more. What can be done to save our children and prevent the third wave to wreak a big havoc as the second wave did? I have with me Dr. Nitin Verma, who's Associate Director of Madhukar Rainbow Children's Hospital, Delhi. He's been Associate Director of Max Super Speciality Hospital, Delhi also, and at AFMC. Welcome, Dr. Verma.
Good afternoon.
We are expecting the third wave, which we anticipate is going to hit children more. So I'd start by asking you, how do you think it's going to affect children? And which age group particularly, if there is, and how lethal or mortal, it can be?
In the first wave, it was predominantly the adults and the elder people and people with comorbidities who got severe cases of COVID, and children had very, very mild disease. Often we didn't require to test or treat them, and most of them recovered without any medication. In the second wave, however, two things happened which are significant. A, the number of children who got COVID was huge. So obviously the virus had mutated. If there was a family of 4 and 2 adults and 2 children, and if one adult got, you can be sure that both the children would also get COVID. So we had a huge number of children who got COVID. Fortunately, by and large, the younger children below 5 had a mild attack. The children from the age group 5 to 10 had a little more symptoms, and the more severe symptoms came in children over the age of 10 years of age. But it's very difficult to create beds for children because these are specialized beds. Ventilators for children are specialized. The equipment is specialized, and the number of people who can manage are very few. So you need trained pediatricians and nurses and doctors to be able to manage. Why are we thinking that the third wave will impact children most? And that is because since a lot of adults have already got COVID, a few are vaccinated and more are going to be vaccinated. The community which is left, which is unvaccinated and not impacted so far, is the children. Since we don't have any vaccine for children, so they're all vulnerable, and that's the reason why we feel that the third wave is going to impact the children more.
If we talk about the vaccination part, Dr. Verma, do we have, we are working on vaccination for children, and are they on the anvil?
Fortunately, now with the success of practically all the vaccines which are available worldwide, studies have started for seeing them in children. Already some of the mRNA vaccines like the Pfizer vaccine are licensed for children up to 12 years of age. So abroad and even in the Middle East, they are giving the Pfizer vaccine to children 12 to 18. In India, studies have started with Covaxin, which is the Bharat Biotech killed vaccine, a safe vaccine, very akin to the influenza vaccine which children already take. And once these studies are done and the results compiled, if it is found to be efficacious and safe, then hopefully we will have a vaccine for the children as well.
What is the treatment regime you would suggest for children? Is it different from the ones that is given to the adults?
In some ways it's similar, and in many ways it's different. So in a child, it can present with fever, cough. It can present with gastrointestinal symptoms, vomiting and loose motions. You think it's a stomach infection, it's COVID. It can present with a skin rash. And in some cases that we are seeing, it presents just as a red eye. So what you think is a conjunctivitis is actually COVID. So the first part to treating is to diagnose. The gold standard, of course, is the throat and nasal swab, an RT-PCR. Confirm the diagnosis, then treatment is based on symptoms. Because small children are have a innate immunity below 5 years of age, they don't get hyperinflammatory storms which adults tend to get. So giving adequate fluids, giving adequate nutrition, giving paracetamol for fever, and giving a dose of vitamin C, a multivitamin with zinc, and adequate amount of vitamin D. That's important, is all that's required. We will monitor, and monitoring includes the temperature, pulse, and also looking at the oxygen saturation of the child. If the child is having mild symptoms, then the monitoring is done remotely by the pediatrician. In some cases, if the symptoms are more, we may take recourse to either blood tests. So these blood tests, routinely done around day 5, are inflammatory markers. So they are looking to see whether there is clotting taking place in the body, you are going in for a pneumonia, there is any inflammation which is happening in the body. So these tests give you an indication. And in some cases, we don't do it in smaller children. Fortunately, when I say we don't, we've not had to do. But in bigger children, you may have to take recourse to a HRCT chest to look for signs of pneumonia. There's a scoring. So the bigger children need to be screened with the HRCT as well. So it's important to diagnose, monitor, and treat.
So how will you categorize which age you are recommending what for what age? Is there an age bracket that this age is this and this age is separate?
So we treat across a wide gamut, from newborns. We've been treating babies born to COVID positive mothers. We've had the youngest COVID baby that we've treated in the hospital was 1 day old. We've had some severe cases, but then you have to understand that Madhukar Rainbow is a tertiary care high-end hospital, so the complicated cases will come to us. One more thing I would like to add for your viewers, and that's, it's not just about treating and the disease is over. It's not like you have a pneumonia or typhoid and you've treated and you're done and dusted. There are complications which are occurring post recovery. Watch out for them. The most important one is something which we call as MISC. M stands for multi system inflammatory syndrome, and C is for children. So this presents with acute high fever. There could be a rash, there could be a red eye, there could be vomiting, loose motions. So it's very important to diagnose it early and then treat based on what the child is. So often you get child with high fever, and because a lot of children are not tested and you don't know that this child has recovered from COVID, you are not thinking of MIS. So you're thinking, oh, it's a fever. Can it be COVID? And you start and you lose time in diagnosing. Yeah. So one of the things that we do when a child like this comes and we're not sure is that besides testing for COVID, we test for COVID antibodies as well. Because once you have COVID antibodies, that obviously is a giveaway that the child already has had COVID and developed antibodies.
In adults, we've seen post-COVID effects have been very, very, very dangerous in some cases, like you had the black fungus and all. So will children also have some kind of after effects of this?
You have to understand that we are still learning about the virus and the disease. The more we treat, the more we understand what all is happening. What we thought was a simple pneumonia is no longer a pneumonia. Where we thought only the lungs are being impacted, we've realized other systems are being impacted. We're still learning about it. So sometimes fever tends to persist for a period of time. You can have body aches, myalgias. So yes, multiple systems are being involved, and therefore the child, like with every adult, who has recovered should be kept under observation, should explain to the parents what to watch out for, so that if any of the symptoms comes, they can report back to their doctor.
But something like black fungus and all these other funguses, maybe these kind of things also affect the child?
Can they affect the child? Of course they can. Fortunately, we have not had a case in our hospital. So, both because the severity is less in children, we don't have very high use of steroids for children unless they come in critical stages. The ventilation is also less so far. I mean, if you see percentage wise, it's not that children don't go on to ventilators. If you compare with how many adults tend to go, and therefore also the monitoring systems, there are specialized people who manage children, right? So except in a hospital where you can have different types of doctors who are managing, here it is being managed by a specialized group of pediatricians and pediatric intensivists. So hopefully the chances of complication are a little less.
What are the precautions and maybe your advice to prevent children from getting into the COVID angle?
Very simple. No rocket science is required for that. How can your or my child get it? Your and my child, if he or she is not going out of the house, can get it from us. Okay. Therefore, you have to vaccinate every adult. And then you have to practice the three cardinal rules of preventing COVID, which is using a mask, hand washing, and social distancing. So inside my house, when I'm in a biological bubble with my family and people who neither go out nor come in, I am without a mask. But once I step out of my house, I will wear a mask. I will keep washing my hands. I will keep a distance from people. And we have to wait for the vaccine for the children to come. The only way, unless the virus dies out by itself, because it's mutating. And we know that with each mutation, the problem is that the antibodies that you produce may not work against the mutant which is there. So I don't think we are over and done and dusted with the vaccine as yet. So if you and I feel that I've had my 2 doses and I'm safe, no, we are not. We are partially safe, and it's possible that in future we'll have to take boosters of either the same or a different strain vaccine or a different methodological type of vaccine that we may have to take in a few months.
What is the possibility of the third wave in our country? As we see, it is already there in some of the European countries and some other countries.
So we know that a pandemic comes in waves. Till such time as everybody is impacted or sufficient number of people can break the barrier of them. But if I am protected and I stop, then it stops at me. So you stop the transmission. So immunity and herd immunity. You protect the elders in the house, you indirectly protect the children, and vice versa. So the third wave will come. We are probably now better informed. We are also, having been hit by the second wave, we are better prepared. And as we are vaccinating larger and larger, and hopefully over the next month or so, as a larger number of vaccines become available, we know that we are expecting millions of doses to be available shortly, then we can increase the speed of vaccination for people. And the sooner we vaccinate people before the third wave comes, the lower is it. How have we conquered this second wave? Let's finish with this. What did we do? We stopped meeting people. You stopped going out of your house. You protected yourself. You have to do that at all times. You can't let your guard down. Don't live in a fool's paradise. So we've had people who had COVID once, they then took doses of the vaccine and they got COVID a second time. Of course, it was mild, but unless you protect yourself, it would be foolish and foolhardy to expect, somebody else or the government or anybody else to protect. We have to protect ourselves. The whole world is facing the storm, right? If we, instead of saying, what can you do? If I say, I will protect myself. If each person tries to protect himself or herself, we will conquer this pandemic soon.
I mean, as if I take it from your point that we have to protect ourselves, but we've also seen keeping children at home protected. As children are not going to school, we are just protecting them by keeping them at home. Doctor, it's been really a difficult task for parents to keep children confined at home, and it's
I,
created
I,
a
I,
lot of
I
other environment of mental stress and so many other things. Would you like to say something on that?
Yes, so there's been a huge amount of mental stress. It's something which we haven't focused enough on. So I think it's as important to focus on that as the third wave. So there's been a huge impact on families, on a mother whose space is now being shared by other people, on a mother who works, but because she's in the house is then expected to do five other things because she's in the house, for a child who can't go out, for a child who can't meet his friends, so to losses of jobs, livelihood, tragedies within families, the fact that children are not able, it's created a huge impact on the mental health of the child and the families. But we are hopeful that we are moving in the right direction. So prevention is better than cure. When can your child go to school? Obviously, when everybody in the school is vaccinated. If the child is not, hopefully by next year this time the children would be vaccinated, everybody else would be vaccinated, and our next discussion may be on how we managed it and how we've conquered it and how we're going to move on.
You really have given us a lot of insight and precious information on how children will have to face it, or parents will have to face it for the children, and what all we should be doing in order to protect this. Thank you so much, Dr. Verma. It was a pleasure talking to you. And to my viewers, thank you so much. And please like and share and comment on the video if you like. And if you want to hear more about us and about issues that are bothering every one of us, don't forget to subscribe and do take care of yourself. Thank you so much.